Dear students, we will discuss a instrument which is again commonly kept in the oxy or viva. So what this instrument is, so that handle is here, both side cups are there. One side bigger cup, one side smaller cup. See that smaller cup, bigger cup. Exactly, it looks like. So the typical of the Volkmann scoop. You know that Volkmann is ischemic contracture, same Volkmann from German probably. It both ends are cup shaped. It is important. It is used to curate or scoop the granulation tissue from the sinus cavities, in the ulcer bed, in the wound, chronic wounds, so that all granulation tissues, unhealthy tissues are scooped very well, and after that give a wash so that healthy tissue will come up. And only after, before placing the graft over the recipient bed, you scoop the granulation tissue so that it will open up. So then place the graft actually for the split skin grafting, pierced grafting. There's also it is useful. So scoop the sinus cavities, granulation tissue for skin grafting or during wound debridement, in the drainage of the cavity, in sinuses, in different wounds it is used for. Many areas it is used, mainly in the wounds. In orthopedic they use it. So this is the Volkmann scope, very commonly kept instrument in the Viva. Very useful instrument, very sturdy instrument it is. Both ends are there, small one side, larger one side. So remember Volkmann scope. So this you can go through my clinical methods in surgery for these different instruments. Students, I request you to join my YouTube channel, SRB Surgery Insight, and share with your friends and colleagues, and press the bell and update your surgical knowledge about specimens, instruments, operative procedure, and briefly case discussion, case scenarios, and operative procedure, illustrations, and so on. And daily, on day-to-day basis, upgrade your surgical knowledge, and also live session once in 2 weeks about clinical presentations of different long cases for lengthy 1.5 hour detailed discussion with the senior professors on online. It will be very useful. And if you join these live sessions, you will get a certificate also, which is useful for your future. And earlier sessions also, please go through the YouTube, then you can always go through that for different discussions, and go through my earlier lectures for last 6 months. It will be very useful to upgrade your surgical knowledge. Go through the MCQ, put the right answer, what this instrument is, A, B, C, D, put the right answer in the comment box. I appreciate your answer. What this test is used for, see that typical of exactly, see that like this, somebody is pushing down. So this is used for orchitis, torsion testis, and cystitis hydrocele hernia. Put the right answer in the comment box. I appreciate your answer. And quotation of the day is, forgiveness is good, but forgiving every bad thing. Somebody has done the murder, don't forgive them. They should be penalized. Forgiving every bad thing is dangerous and unjustified. Justified forgiveness is important. So everything cannot be forgiven, even though forgiveness is a good nature. That is a quotation which should be remembered. Students, and also go through my SRB's Manual of Surgery current edition for in detail subject matter with the MCQs online, and everything in Oxy is covered, from general surgery, endocrine, thyroid, breast, parathyroids, GI surgery, everything, liver, gallbladder, GI tract, stomach, hernia, urology, specialties, cardiothoracic, neurosurgery, basics, instruments, specimens, anesthesia, and briefly recent advances with a lot of illustrations, photos, quotations, and treatment strategy, management policy, principles, with a lucid, understandable language. With the wherever Oxy topics are there, also it is covered for both UGs and PGs. So make use of my SRB's Manual of Surgery for your better understanding of surgery knowledge as such. And also my SRB's clinical methods in surgery. It covers all clinical examinations, general surgery to hernia, thyroid, breast, varicose vein, vascular diseases, GI examination, abdomen, briefly orthopedic, and with the instruments, specimens, and briefly images as such. Video examination of each topic, each chapter, which will be very useful for your clinical examination, and principles of examination with a lot of photos, and brief differential diagnosis in tabular form. But it doesn't contain, because it is a clinical book, it doesn't contain any management policy. For management policy, you have to go through the SRB's Manual of Surgery. But clinical book, it is very useful. Everything in detail it is there. So please purchase my clinical book and Manual of Surgery to have a complete understanding of the surgery as such. And my operative surgery Current edition with the 2 volume extensive book, about 10,000 photos and illustrations. Very, very useful for upcoming surgeons, surgical surgery PGs, and practicing surgeons. In detail, step by step, all procedures, even GI surgery, general surgeries, endocrine surgeries, everything step by step with a lot of photos and illustrations, with the instruments, energy sources, everything it is covered. It will be very useful for all surgeons who is practicing. Before surgery, they can go through the steps and do the procedure skillfully without much problem. So please go through my SRB's operative surgery atlas and guide atlas, actually text and atlas, current edition 2 volume book. Very, very useful. Definitely you'll understand the technique. Small procedure to big major procedures as such. My SRB's tissue approximation, again brief small atlas book, 100 pages, which shows how to approach different suturing techniques, different methods, different types of suturing, different skills of suturing, different suture materials, and skin suturing, deeper tissue suturing, bowel suturing, laparoscope suturing, with the principles, and also with the video of suturing. How to do all suturings are videos are there. That also very, very useful for all students. So please go through that. My SRB's tissue approximation book also. So students, again I request to subscribe my YouTube channel to have a best surgical update as such, a daily day-to-day basis for your clinical knowledge, image-wise, and also join live sessions once in 2 weeks for extensive knowledge about the clinical discussions for more than 1.5 hours. So again request, please subscribe my YouTube channel, share with your friends and colleagues, and press the bell. So students, I hope you understood this lecture very well. Thank you so much.